At this time, we have come now to the point where we will take away the arachnoid membranes and with them the blood vessels on the base of the brain. But before we do that, we must take the opportunity to look at the large blood vessels on the surface of the brain. The brain is supplied with blood through two large arteries on each side of the brain, the internal carotid artery and the vertebral artery. Cerebrovascular accidents, CVA, or strokes, as it's commonly called, are very common. And as usual, the symptoms are dependent on where in the brain the lesion is located. To begin with, it helps to remember that the two arterial systems, the internal carotid system and the vertebral system, supply different territories of the brain. Although there are anastomosis between the two systems, there is very little mixing of blood between the systems under normal conditions. The four large branches of the vertebral system are the posterior inferior cerebellar artery, pica, the anterior inferior cerebellar artery, ica, the superior cerebellar artery, and the final large branch, the posterior cerebral artery, which supplies the caudal part of the hemisphere with blood. Since the vertebral arteries supply the posterior part of the hemisphere, the cerebellum, and the brainstem, lesions in the vertebral basilar system will give symptoms related to the functions of these areas. That means visual symptoms, since the posterior part of the cerebral hemisphere contain the cortical areas for vision. Cerebellar symptoms. Cerebellum is the most important structure for the coordination of movements. If cerebellum is involved, the patient may lose muscle coordination, and loss of muscular coordination is called ataxia. Brainstem syndromes can be of various kinds depending upon which part of the brainstem is involved. The two large brain arteries of the internal carotid system are the anterior cerebral artery and the middle cerebral artery. And they supply the rostral two-thirds of the brain. Lesions in the internal carotid system are characterized by contralateral motor and sensory signs because the large motor and sensory tracts in the brain and that are related to one half of the body cross the midline in the lower part of the brainstem. Weakness or loss of voluntary movements on the contralateral side is called hemiplegia. Loss of sensation on the contralateral side, hemianesthesia, and blindness in the contralateral visual fields, hemianopsia. If the lesion is located in the left hemisphere, the patient is also likely to have difficulties with language, since the left hemisphere specializes in language in about 95% of the population. Difficulties to speak or to comprehend language is called aphasia. Since the vertebral artery and the internal carotid artery approach the brain from below, we have to look at the ventral surface of the brain in order to identify these various arteries. This brain smells of formalin. I wanted to have a brain with photogenic blood vessels. Formalin ain't no sweet perfume. Don't let this happen to you. Make sure you wash the brain in running water at least a few days before the brain dissection. But the blood vessels show up nicely in this specimen. Before we look at the individual blood vessels, we have to take away some of the arachnoid that is still left here on the base of the brain. Use a pair of scissors so you don't rip off the blood vessels with the arachnoid and cut the arachnoid around the blood vessels like this, so that we can get a nice picture of the various blood vessels. Here they go, like that. Well, we'll start here where the two vertebral arteries come up in through the foramen magnum. As you can see here, one of the first, really the first branch within the skull cavity from the vertebral artery is the posterior inferior cerebellar artery. And the posterior inferior cerebellar artery makes a very characteristic loop here between the medulla oblongata and the cerebellum. Here it is on this side, and I think we can see it on this side as well. Here it is, making this loop between the medulla and the cerebellum before it reaches the inferior surface of the cerebellum. There is usually another artery that can be seen here, and that is the anterior spinal artery coming off here from the vertebral artery and supplying the spinal cord. The two vertebral arteries come together here at the level of the upper part of the medulla oblongata and form the basilar artery here on the surface of the pons, this large structure underneath. And there are usually two large cerebellar arteries branching from the basilar artery. Here is one, rather small on this side. This is the anterior inferior cerebellar artery that goes to the lateral surface of the cerebellum. There it is on this side, and here it is on this side. There is another large artery coming off all the way up here. This is this artery, that is the superior cerebellar artery, swings around the brainstem and supplies the superior part of the cerebellum. Here it is on this side. Let's take away the arachnoid, and here you see it again. This is the superior cerebellar artery. As a matter of fact, on this brain there are two of them, two small superior cerebellar arteries coming off. At the upper part of pons here, the basilar artery divides into its two large final branches, the posterior cerebral artery, one on each side. Here it is on this side, swings around the brainstem and disappears between the cerebral hemisphere and the cerebellum. Let's look at this side of the brain, and we will, here it is. I'll hold it here between the forceps, like this. A little further rostral here are the cut ends of two large arteries, one on each side, and that's the internal carotid artery. The internal carotid artery comes in through the skull, and it penetrates right through one of the cavernous sinuses on the base of the brain, the cavernous sinus. And after it has penetrated the cavernous sinus, there is usually a large branch that proceeds to the orbit, and that's the ophthalmic artery. It has been cut off here because the internal carotid artery was cut too close to the surface of the brain, so we cannot see it on this brain specimen. But we can see the two other large arteries coming off from the internal carotid artery. That's the anterior cerebral artery here, anterior cerebral artery that disappears here between the two cerebral hemispheres. And we cannot follow it any further until we cut the mid-sagittal section through the brain. The other large artery that we will see is the middle cerebral artery, and that is the artery that proceeds out here as you can see, between the frontal lobe and the temporal lobe. Let's take away a little bit of the arachnoid again. And you can follow it all the way out here. If we look on the lateral side, it branches here on the surface of the insula, which is a lobe of the cerebral hemisphere. And many of the branches continue further laterally and emerge from the lateral fissure here to supply most of the lateral surface of the hemisphere. The middle cerebral artery is the artery most often affected by stroke, and the effect can be devastating to the patient. Why is that? Well, let's contemplate this for a moment. The lateral surface of the hemisphere will look like this. We'll now make a cross-section like this. And it will appear here. Here you see a cross-section through the cerebral hemisphere. This is the part of the temporal lobe. Here is the rest of the hemisphere. And here are the opercula coming up, covering the insula here in the depths of the lateral fissure. And as you can see, we have drawn in the middle cerebral artery, coming off here from the internal carotid artery, proceeding laterally underneath the frontal part of the brain, out here towards the insula, where the artery branch, and then many of the branches proceed out and emerge from the lateral fissure then to cover most of the lateral surface of the hemisphere. Let's go back to this drawing here to the left. In the central part of the hemisphere, on the lateral surface, is a motor and a somatosensory cortical area. Like this, in which the different parts of the body are represented in a strip-like fashion on both sides of the central sulcus in the middle. The motor cortex is important for generation of movements, and the somatosensory cortex for the analysis of sensations. Furthermore, important language areas are located in the left hemisphere. The anterior language area, the Broca's area, is located in front of the lower part of the motor cortex, which is related to the muscles of the lips, the tongue, and the larynx, parts necessary for making sounds. The area immediately rostral to that part of the motor cortex is Broca's area, which is necessary for the production of speech. In other words, a patient with a lesion in Broca's area has difficulty speaking, even if the muscles of articulations are intact. In the posterior part of the hemisphere, at about this level, is a large posterior language area, Wernicke's area, which is important for the comprehension of the written and spoken language. Since all these functional areas are located within the distribution area of the middle cerebral artery, the symptoms following a lesion in this artery can be many and very serious, especially if the lesion is on the left side of the hemisphere. With this background, let's take a second look at the middle cerebral artery, especially since this artery has some very characteristic features which underscores its prominence in clinical neurology. Here is the internal carotid artery with its two branches, the anterior cerebral artery here and the middle cerebral artery. There is a unique anastomotic circle on the base of the brain, and it is formed by the two posterior communicating arteries, one on each side here, connecting the posterior cerebral artery with the internal carotid artery. Here it is, posterior communicating artery on that side. Well, the circle, which is referred to as the circle of Willis, after a famous English physician that described this circle about 300 years ago, it is completed by a very short anterior communicating artery here in the front between the two anterior cerebral arteries. We'll come back to the clinical importance of this circle within a while, but let's then take a look at another artery that we can see nicely here. If you take a look here, coming off from the internal carotid artery, it's a very important artery, namely the anterior choroidal artery. It proceeds laterally here and disappears in a fissure that we refer to as the choroid fissure. That is the fissure, or that is the artery that gets into the choroid plexus of the lateral ventricle and supply most of that choroid plexus with blood. Well, now, back to the middle cerebral artery here. Look, doesn't this amaze you? Look what an impressive artery this is. Look at the branching pattern of this artery. And if you cut here away part of the temporal lobe like this, you'll be able to see better this tremendous artery and its branches. Well, no wonder that the middle cerebral artery is the primary stroke artery of the brain. We'll go back to the drawing that we have here. And look here. Here comes the middle cerebral artery. All the branches coming off. It proceeds lateral towards the insula and, of course, supplies all of the rest of the hemisphere. And there are some very important arteries coming off this proximal part of the middle cerebral artery. These are the arteries that supply the deep part of the cerebral hemisphere. They are referred to as the lenticulostriate arteries, several of them. And they are very often the site of bleedings in the brain. And you can see also, of course, if there is a blood clot in this part of the middle cerebral artery, practically the whole hemisphere might be affected like this. We'll go back now and take a closer look on our specimen and try to find these lenticulostriate arteries. Now we'll go right for the lenticulostriate arteries, coming off here from the proximal part of the middle cerebral arteries. Look at these arteries coming off this part, penetrating the brain or perforating the brain. Here we take them away, here, like this. And there are perforating arteries not only from the middle cerebral artery, but also from the other arteries here at the base of the brain. You see many of them coming here from the posterior communicating artery here, like that. Now, what we will do is cut loose the internal carotid artery on this side, cut through the posterior communicating artery and the anterior cerebral artery, and then we will strip away the middle cerebral artery with all its branches like this. Now, I would like for you to take another close look at this area where we have just stripped away the arteries, the perforating arteries, this region here, because when we stripped away all these arteries, there are small holes that appear on the surface of the brain here. Hope you can see that. There are small holes because of this lenticulostriate arteries that went in this region. And this area is referred to as the anterior perforated space. And the anterior perforated space continues here through the Lehman insula with the base of the insula at this level. Let's take away the rest of the arterial tree now, cut through the big arteries where they disappear, posterior cerebral artery, and the other arteries like this. And we will take the middle cerebral artery on that side, strip away. Look at these perforating arteries coming here from the circle of Willis. Cut this away, and then we will take the anterior cerebral artery like this. And then we can lift the whole arterial tree up like this. And you will see when we take away these arteries here, the posterior part, and clean this area, which is the interpeduncular fossa here, you have the same type of holes from the arteries that have perforated the brain surface, and that's the posterior perforated space. We'll now review briefly the large arteries on the base of the brain before we remove them, and we'll then go on to study some of the other structures on the surface of the brain. We'll take a look at this drawing of the major arteries on the basal surface of the brain. We'll identify the different large arteries. This is the anterior spinal artery. The posterior inferior cerebellar artery, which make this characteristic loop, this is pica. Pica. The anterior inferior cerebellar artery, ica. Ica. The superior cerebellar artery, on this drawing, superior cerebellar artery, and finally the main branch of the basilar artery, this posterior cerebral artery, coming here, supplying the posterior part of the cerebral hemisphere. The internal carotid artery here divides into the middle cerebral artery, here the middle cerebral artery, and the anterior cerebral artery here, anterior cerebral artery. The circle of Willis is a device which could literally mean the difference between life and death. Through the anterior communicating artery between the two anterior cerebral arteries and the two posterior communicating arteries between the carotid system and the posterior cerebral artery, an arterial circle is formed, which may provide collateral circulation in the case of an emergency. Normally, there is very little mixing of blood between the internal carotid system and the vertebral basilar system. But let's assume that the sclerotic plaque at the region of the carotid bifurcation gradually shuts down the blood supply through the internal carotid artery on that side. If the circle is well developed, or if it's given a chance to adapt to the new situation, collateral circulation can be established either from the opposite side via the anterior communicating artery here, or through the posterior communicating artery from the vertebral basilar system. I mentioned previously that the middle cerebral artery is often involved in strokes because of predilections for bleedings in the lenticulostriate arteries. Well, here's another reason why the middle cerebral artery is often involved in strokes. Suppose a blood clot detaches from the heart in a patient with a heart disease. Such a detached blood clot, called embolus, can easily find its way up into one of the internal carotid arteries. And since the middle cerebral artery is the direct continuation of the internal carotid artery, the embolus, unless it is a real twister, of course, will be flushed right out into the middle cerebral artery. And depending on its size, it will lodge itself either in the main trunk or in one of the branches, with the effects that we alluded to earlier. Let's now go back and finish the dissection on the basal surface of the brain. Don't be surprised if the large arteries on the base of the brain don't look the way they do in your book, or if the circle of Willis doesn't work the way it's supposed to in a patient with a cerebrovascular disorder. Well, as a matter of fact, there are quite a lot of variations in the circle of Willis, and I've taken a new brain here to make this point. Look here. Here on the base of the brain, this is the posterior cerebral artery, and as you can see, this is where the oculomotor nerve, the third cranial nerve, swings around the posterior cerebral artery. The posterior cerebral artery is the branch, the end branch of the basilar artery here. But as you can see on this side, it's very, very thin. Look at that. Whereas, if you go and take a look here at the posterior communicating artery, it looks rather thick. In other words, it looks as if the posterior part of the cerebral hemisphere on this side will get most of its blood supply through the posterior communicating artery coming from the internal carotid system rather than through the vertebral basilar system. Well, now what we will do is very carefully, again, take away the circle of Willis from the base of the brain, cut through here the large arteries where they disappear, and be a little careful when you strip it open here so that you don't also rip off the cranial nerves together with the arteries. Now we get it up like this. Well, here are the circle of Willis with all the perforating arteries. And as you can see, it is not a perfect circle, but it does hang together.